Here we are in the very last chapter before you start your research projects. We talked all semester about how you became the person that you become. And then after that, we talked about how if you know yourself, you will be able to better understand the world. But on occasion, things go wrong and we have mental disorders. And as I was talking in the last lecture about mental disorders, I did mention that the best treatment for mental disorders is typically a combination of therapy and medication. If the psychological disorder that you or someone you love has, or anybody else, if it's a neurotransmitter problem, there needs to be medication involved, just like when you have physical disease or symptoms caused by internal things, we treat it with a medication. If you have an infection, we use an antibiotic. Same with mental disorders. If you have bipolar disorder and you have high or low levels of certain neurotransmitters, we need to treat that malfunction of neurotransmitters. When it comes to the therapy side, and most therapists would probably tell you that therapy is the route that they want to go, you are changing a person's lifestyle to help them better function in the world. There are several different types of therapy out there. What is right for one person may or may not be right for another person in the same or similar situation. And of course, when the situations are very different, there's going to be a recommendation of different therapies. At the very end of the other lecture, I also said if you for some reason come into contact with a therapist that you don't feel comfortable with, or you're not getting the results that you think you should be getting, switch therapists. We go to doctors and get second, third, fourth opinions all the time. But for some reason with treating mental disorders, which is almost considered taboo in the United States, it's okay to go ahead and get a second opinion. I'm going to leave you with these last words again. You wouldn't go to a podiatrist for a heart problem. So please, 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 if you have a mental disorder, get the right help, get good help, get help from an expert in the field. Use therapy and medication from experts in the field, a psychologist or a psychiatrist. Not saying that your general practitioner can't help, but make sure that you're getting expert information. On to the projects where you guys will tell me how to best treat, whether it's through medication, surgeries, or therapy, someone with a particular mental disorder.